you know that every 40 seconds, someone in the U.S. has a stroke? With May being National Stroke Awareness Month, it's a time to highlight the importance of recognizing the symptoms and also preventing a stroke. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Pola Hoyecka, vascular neurologist at the Queens Medical Center. Good morning, doctor. How are you doing this morning?
I'm doing well, Ross. Thank you. How are you?
I'm doing excellent. Now, first off, what is a stroke?
Well, that's a great question. And as you just mentioned, Ross, that it's National Stroke Awareness Month. So the first thing is talking about what exactly is a stroke. Well, one way you can think about a stroke is a brain attack, very much like we think about heart attacks. For a stroke, it can be a clot in a blood vessel in the brain or a clot in a blood vessel that goes to a brain. It can also be bleeding inside the brain. And what happens is then you get damage in the area where that clot or that bleed is. Strokes happen out of nowhere. They're all of a sudden. You don't see it coming. You're doing fine 1 minute, and the next minute, all of a sudden, you can't do something that you can normally do. The most important thing is getting the stroke treated quickly as soon as possible. We have treatments for stroke, but they only work if you get them in the first few hours. In neurology, we have a saying called time is brain, meaning the longer you wait, the more brain can get damaged. And the best way to save your brain is to get help as soon as possible.
Now, what are some of the warning signs of a stroke?
So, Ross, the thing is, anyone can have a stroke. We usually think about older people, people who have a lot of medical problems, but young people can have a stroke, healthy people can have a stroke, even teenagers and kids can have strokes. One way you can think about stroke that's really easy to remember, the signs of a stroke is the loss of any ability of things that you can normally do. So all of a sudden, you lose that. And one of the acronyms that we use is an acronym called FAST. That stands for face, arm, speech, and time. So you can have symptoms in your face, your arm, or your speech, and it's time to call 911. But these aren't the only symptoms of a stroke. You can also have problems with your vision. You can fall, you can have dizziness, you can have a headache, vomiting, or fainting. Any of those things can be symptoms of a stroke. And if you have those symptoms, call 911. Don't wait. Don't try to sleep it off. Don't wait for someone to get home and drive you to the hospital. Just call 911. That way you can get those treatments right away to give you the best chance of getting better.
Now, a lot of people at home are watching. They're wondering, how can you prevent yourself from getting a stroke?
That's a great question, Ross. You know, the best treatment is to prevent it from happening in the first place. I would say it's very important to educate. Educate yourself and educate your family. You can look it up online, ask your doctor, what are the signs and symptoms of having a stroke, and have a plan. What should you do in case you think you or someone in your house might be having a stroke? Teach everyone, including your kids, how to call 911. See your doctor regularly. I would say at least once a year, and that way you can stay on top of the things that can increase your risk of having a stroke. Work with your doctor to keep your brain, your heart, and your blood vessels healthy. And these are things like eating a healthy diet, exercising regularly, staying on top of your blood pressure, your blood sugar, diabetes, staying on top of your cholesterol. If you smoke, you should stop. Talk to your doctor about ways he can help you stop. If you stop smoking, that cuts your stroke risk in half right away. Other things like heavy drinking and drugs such as methamphetamine and cocaine can also lead to strokes. So it's important to avoid those things. And remember, a stroke can happen to anyone. Again, if you're healthy or you're young, it can happen to you as well. So take these steps to try to keep yourself healthy.
Now, to learn more about the services being offered by the Queens Neuroscience Institute, you can visit www.queens.org, click on Services, then click on Neuroscience. Or you can give them a call at 808-691-8866 at their Punchbowl location, or 808-691-3135 at West Oahu. Thank you so much, Doctor, for your time, and have a great day.
Thank you so much for having me, Ross. Have a good day.
You too.
Aloha.